coming. I want to thank the Ted, the Liberty, and all the folks at St. Francis for providing this venue here today. It was actually incredibly convenient because we had a campaign event last night, and one of the women who was there fainted, got sick, was brought to the hospital. She's here. I just went to see her. She looks fantastic, so I'm sure she's getting great care. This is really a great spot for me to be unveiling my plan for health care in Delaware, because St. Francis is a full-service community hospital, and it's got a mission of providing quality, compassionate care to everybody, regardless of their ability to pay. My understanding is that the hospital spends close to $20 million a year serving the poor and the underinsured, and more than 50% of the patient population at St. Francis resides in the city of Wilmington and lives in the most socially and economically disadvantaged communities in the state, with high rates of people living in poverty and lacking health insurance coverage. And it's with that as a background that I choose to unveil my plan for health care reform here in Delaware. And I'm pleased to be presenting what I believe to be a comprehensive vision for health care in Delaware. I have released today a detailed plan for quality, affordable health care that will improve care, that's financially responsible, and lays out specific implementation steps, including costs and funding sources. And my plan reflects my fundamental belief that all Delawareans deserve access to quality, affordable health care. We need a comprehensive solution that provides more affordable options for everybody and reduces costs for those who already have health coverage. But we've got a few problems here. First, health care costs are threatening to overwhelm families, businesses, and state government. More consumers are paying higher deductibles, higher insurance co-payments, and they're receiving less comprehensive coverage of treatment and of drugs. The bottom line is that consumers feel squeezed by so many things: higher energy prices, higher tuition prices, and certainly high health care prices. Secondly, we've got more than 105,000 uninsured Delawareans, and these are hardworking people. More than 80% of uninsured Delawareans are actually in working families. People who work hard and do their fair share should not be left wondering whether they'll be able to pay their bills if an illness or an accident strikes. And it's critical to understand that the problem of the uninsured extends to all of us, because the typical family in Delaware that has health insurance pays an extra $724 a year in premium to subsidize care for those who do not have health insurance. So the problem of the uninsured extends to everybody. And finally, we're often not getting what we pay for, because all the money spent on health care in our state is not necessarily buying us better health. Now, why is that? It's partly because when we pay for uncompensated care for the uninsured in hospitals, or in emergency rooms, it's really the equivalent of paying for a new engine instead of an oil change. The bottom line is we're spending too much at the back end and not enough on front-end coverage and preventive care. And I believe that Delaware should invest it's about $91 million that's currently spent in our state on uncompensated care into a system of affordable, quality health care for everybody in the state. This plan will improve health care and can actually help save us money. We need a system where there's shared responsibility. My plan offers that. We need a system of flexible, portable coverage, and my plan offers that. Delawareans may be afraid to change jobs or, frankly, to start their own businesses if they're afraid of losing health insurance. And my plan provides a source of portable coverage. It's called the Diamond State Marketplace, that allows people to take their coverage with them from job to job. It allows entrepreneurs to obtain a range of affordable health plans that meet their needs. Some of you may have read a few weeks ago I released my economic development plan for Delaware. It was very much focused on making Delaware more attractive to entrepreneurs. So this idea of giving people more confidence that if they leave their job, they can actually take their health care with them is a big deal, because right now a lot of people, understandably, are afraid to leave their job because they may lose their health care. Cautious incremental change is not going to achieve these goals. They won't achieve them soon enough for the Delaware families and businesses that need help today. Let's be clear. Comprehensive reform is going to be difficult. This is very hard stuff. We may need to phase it in. We may need to achieve it in steps. But Delaware needs a leader to outline a bold vision for change. Everybody in Delaware ought to have health insurance, and I'm the only candidate with a plan to cover every Delawarean. Other states are moving forward. Delaware is falling behind, and this is an area where we should be. So with that, I want to just stop my prepared remarks. I'll be happy to take any questions. If you've not received a copy of the plan, please raise your hand. It's 15 pages. It's very detailed. I lay out very specifically what this is going to cost. And I think, frankly, you've got to do that. When you're talking about a plan as bold as this one is, which is talking about creating health insurance, making every Delawarean, giving every Delawarean the opportunity to have health care. You can't just sort of say that kind of thing and not say how you're going to make it happen. So in this plan, we're saying exactly how we're going to make it happen, and we're also saying how much it's going to cost. I'd be happy to answer any questions.